Hello, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we are going to talk about um, how Bartonella affects the mouth and the esophagus area. And there's not a lot published on this because there's not a lot of research done on Bartonella. I can only speak from personal experience and from talking to thousands of patients that in my opinion, Bartonella has a particular affinity for the mouth, the throat, and the esophagus. And some of the symptoms that can manifest as a result of having Bartonella residing in those tissues is you get a hoarse voice, you have some like throat and esophagus irritation that when you go and get a scope, they don't find anything except for that it's a little bit inflamed. You have some tenderness and epigastric discomfort, sort of at the bottom of your sternum at the top of your stomach. And you have severe reflux and GERD. GERD is gastroesophageal reflux disorder. So for whatever reason, Bartonella seems to really just play havoc on the esophagus and the throat, and it can really harm your vocal cords, in my opinion. And when you talk to anybody about this, nobody really acknowledges that, but I do, because I'm somebody who suffers from Bartonella in the sort of the upper GI tract. Okay. And it's been very irritating. I go to GI docs. I've had 2 endoscopies, and they never say that they find anything, and that. But it feels irritated. It feels inflamed. And the other thing is, sometimes I have burning mouth, and sometimes my patients have burning mouth, and that seems to be somewhat correlated with Bartonella as well. I think hormones also play a role. I think declining estrogen and declining progesterone lends itself to burning mouth syndrome. But I see burning mouth syndrome in Bartonella, and I also sometimes see it in mold. So, unfortunately, there's no real treatment for burning mouth syndrome. You can use gabapentin for pain, but it doesn't really work that well. Another thing you can do is stabilize the mast cells. MCAS, mast cell activation syndrome, is, I think, very much involved in Bartonella taking up residence in your upper GI. And, stabilizing mast cells, you can do that with Hist-AO, cromolyn sodium, Allegra, Zyrtec, D-Hist, quercetin. You can even use doxypen, hydroxyzine, even to a certain extent LDN, low-dose naltrexone, to help stabilize the mast cells. Because mast cell destabilization, I think, contributes to the discomfort that you feel in your esophagus. And another thing you can do is drink aloe. Aloe is very soothing to the esophagus. You can use glycyrrhiza. You can take glycyrrhiza, which sometimes helps with GERD. But one thing that I've found that really helps the most is drinking ginger ale over crushed ice and drinking hot tea. Both of those things really, really help my GI and my esophagus. So, unfortunately, we don't have a lot of things that help this situation, and I'm sorry about that. I'm trying to work on it because I suffer from it too. So, I hope that you found this helpful, and I hope you have a wonderful day. Take care. And happy Thanksgiving.